What's up, everyone? This is Dr. Charlie Johnson. Appreciate you checking out the channel. I'm here with Caleb. Caleb is from Virginia. I just confirmed that. Caleb is from Virginia. I've never actually met him in person, but he is a member of our Glute Relief Accelerator Program. And Caleb, I'm just like super appreciative, man, to have you here because your story is so common, fortunately or unfortunately, however you want to think of it, right? And there's many people out there, man, who I know, if you're in pain, you're watching this, you've tried lots of different things. This story, I think, will be really inspiring for you and hopefully get you over the hump to recognize that there is an alternative way out, and you can solve this if you have the right tools, knowledge, and understanding. And that is the intent of what we do inside of my specialty program, where we teach people how to use the power of their mind and movement as medicine to get out of pain, even if you've been in pain for years. So what I want to do, Caleb, if it's cool, man, is I'm just going to ask you some questions about sort of your experience. And again, I'm just so glad we can connect to do this and sort of share what you've been going through. Cool?
Sounds good.
Awesome, man. So let's do this. Okay. So to kick it off, right, can you share sort of like how long you had been in pain, right? And then what you were told was wrong with you prior to, entering the program, if you will.
I started to notice pain in my piriformis area on the left side about 5 years ago, and that progressed over time. I'm a long distance runner, and it wasn't really impacting my ability to do marathons and keep running the way I want to until probably the last year to 2 years. Mm-hmm. The pain got so bad that I was unable to drive for, no joke, 10 minutes without needing to pull over, and honestly feeling like I was in full body sweats because the pain was like at a 10 out of 10. Like I was just having a hard time sitting at work, hard time driving to work, hard time functioning. Didn't really want to go to restaurants, didn't want to be around anyone because sitting is a part of our life. It's what we have to sit to live. And I was afraid to do it because I was in so much pain.
Wow.
I started to seek medical treatment for it about 2.5 years ago, when I was living out west. And between that time and now, I have seen counting physical therapists, sports medicine doctors, neurologists, close to 10 providers. All of them have given me a different label, from hamstring syndrome, piriformis syndrome, high hamstring tendinopathy, pubic symphysis degeneration, L5 retrolithiasis, problems with my hips, labral tears. I've been given so many diagnoses over the course of the last 2.5 years since I started seeking treatment until I met you, man.
Cool, dude. Yeah. And so you got your own medical degree in some sense, right?
Exactly.
And so, yeah, man, so you were told you had all kinds of things, from piriformis problems to hamstring problems. You even had like a surgical intervention, kind of, if you will, right? Hydrodissection, stuff like that. We'll talk about that here in a minute. But basically, lots of different diagnostic labels, but nobody could really agree upon what was causing it. Is that fair?
Mm-hmm.
Now, let me ask you this, man. Were these like nobody doctors? Like small town, like, yeah, they don't know anything, right? Are these like pretty sharp people? Like, give me an idea of like who you saw for these things.
Yeah, that was the most disheartening part is, I was going to the top doctors in Virginia. I went to a doctor who used to work with the New England Patriots, and I was so hopeful going into that appointment, like, this guy is going to fix me. There's no way this guy doesn't have the answer. And I left that appointment with him saying, I don't know what's wrong with you. You have the tightest hamstrings of anyone I've ever worked with. So that, that made me feel really good, since, he worked with the New England Patriots. So I'm like, I've been thrown around the medical system, but with really good providers who have been unable to give me an answer.
Yep. Got it. Okay. So yeah, man, again, got a whole slew of different things. Nobody could really agree upon what was happening there, right? Been in pain for, we'll just say 5-ish years, but it's really got worse in the past couple. Yeah. You're a speech therapist, right?
I am. Yep.
Cool, man. But you do some home health stuff. So you're driving a lot. Like, how much were you driving, like, every single day?
Yeah, close to 200 miles a day.
Wow. Okay. And so, like, what did that look like, man? You were like pulling over on the side of the road, like you were just like gritting your teeth, because you can only sit 5-10 minutes. That's not good.
Yeah. Honestly, the route that I have to take patients, or to go see patients, I know where every gas station within like 100 miles of here is, every rest stop, any possible area that's safe to pull off. I was doing so. a lot of just gritting my teeth. Let's get to 20 minutes, then you can pull over and stretch and stand up, and just kind of that, just not really an efficient or fun way to live.
Yeah. And so basically you structured your life almost around this pain, right? Your work, your life, like you would avoid, again, maybe going out, doing things with, I mean, you're a young dude, right? Like with friends, maybe with other people, right? Like socially. Yeah, work, you were able to do it, but it was literally a pain in the butt. And so you had your routine, right? Around how you would kind of manage or live with this pain, correct?
Yeah.
Yeah. Yeah, man, cool stuff. So let me ask you this, right? Let's just flash forward so that people can kind of see. So how long have you been working with me, roughly?
Not even a month. I started working with you on July 17th.
Yep. All right, cool. So not even a month, right? And like, would you say like you're a little bit better, or like where would you say you're at, right?
I would say I'm well past 50% better. I started
Cool.
feeling better literally at the 2-week mark, if not even sooner than that.
Cool.
Yeah.
Yep. So you could sit for maybe like 5-10 minutes where you would grit your teeth. Like, where would you say you are now? Like, 4-ish or so weeks into the program after 5 years of pain. Like, are you able to sit for longer than that? Or are you not? Where are you at now?
Yeah. I mean, I definitely still notice like, okay, maybe my foot's a little numb or I'm a little uncomfortable, but that's not coming until the end of the day when I'm on my commute home.
Mm-hmm.
Like, it's
Cool.
not even something that I feel I have to grit through anymore.
Yep.
Yeah.
Neat. Awesome, dude. And yeah, because you had like butt pain, both sided hamstring pain. You also had like almost constant, pretty consistent right foot numbness, right? All of which is definitely headed in the right direction. Again, we're not there 100%, but you've already, I think, like, let me ask you this, man. Do you feel like you have most of the tools and knowledge and understanding as far as like the path and plan to get yourself to 100%, only just a month or so into the program?
Absolutely. Yeah.
Cool. So it's no question that you're going to get there. All right. And for anybody else watching, right, the intent is to teach people how to fix themselves. We are very much bred into a healthcare system, at least here in the US, but seems like almost everywhere because we work with people all over the world, right? Where it's like, hey, you go to someone really smart and they're supposed to know what to do with you and then fix you. And if they can't, like you said, Caleb, then you kind of feel screwed, right? Because you're like, if that, and you even said this to me, man, you shot me a personal message. You're like, if that really smart person can't figure out what to do with me, like that is really discouraging because who can, right? And so all those things are moving in the right direction. I know you hadn't run too for quite some time. Like, how long had it been? Because I know you're running a bit now, but you stopped running at some point. Was that a year ago, 6 months ago, 2 years ago? Like, how long had you stopped running for there?
In the early part of this year, I was still trying to run like a day a week, just whenever I possibly could, but it always flared my pain so much. I mean, I used to run an average of 80, 90 miles a week. I was running a lot. And
Yeah, that's
so
a lot.
I went to nothing. But now let's see, the last couple weeks, I've done 20 miles in the week. So yeah, the last 2 weeks I did 20 miles, which is just huge. I mean, to go from zero running whatsoever to be able to do a 10-mile run in the mountains, lots of climbing, and sure, the pain's there when I do it, but I know how to process it.
Yeah, cool. Awesome, dude. So all right, so now let's kind of go back to the middle. So, right, you have this snapshot. You feel like you have the tools, knowledge, and understanding to keep moving forward. I have no question about that. And again, my experience is that most people can learn what they need to do within like a 6-week time frame, although it may take a little bit longer to fully resolve some of these chronic things. Most people see results pretty quickly. You said you saw results after 5 years of essentially no results. You saw it within like the first 14 days, moving in the right direction. And now we're just compounding and putting in the reps with the techniques and strategies that you're learning to get you there, and you're going to get there. Okay. And so let's kind of go back to the meat of the story, right? Where it's like, you were dealing with this stuff, this butt pain, this glute pain, hamstring stuff, right? We're given all these different diagnostic labels, seeing all these really smart people, right? And couldn't really help you. But like, what did that look like? So how, like, give me an idea if you're willing to share, right? Because I know you were super skeptical to begin. And so I want to touch on that. Like how much do you think, if you're willing to share, how much do you think you spent on trying to solve this, man? Can you give me an estimate?
Oh man, that's something I don't even want to think about. Just a lot. I mean, I've had Oh gosh, I've seen acupuncturists, chiropractors. I've had dry needling done. I've maxed out. I maxed out my insurance for physical therapy by like May of this year. They weren't covering any more visits. I had maxed that out. I've had, since I started seeking treatment for this, upwards of 8 steroid injections. I've had multiple rounds of hydrodissection in my hamstrings and my glutes. Spent a lot of money trying to figure this out. A lot of money trying to figure this out.
Yeah, man. And like 10 PT sessions, like 30, like, I don't know, man. What are we talking here? Just like a
20,
couple little eyeballs?
20, and then I was paying out of pocket too.
Wow, dude.
So, well, probably close to 30 just this year.
Wow, man. And that's just this year. Holy smokes. So let's just say that you felt as though you tried everything. Is that fair to say?
Oh, yeah.
Cool. Okay. So let's talk about this, man, because this is where a lot of people are at, right? They're going to watch this and say, like, you know, maybe I paid Caleb to do this, or I don't know, maybe this is made up or whatever, right? But at the end of the day, I think you can probably vouch for me that it's not, right? It's real stuff. But really fascinating, man, because I can't tell you how many times I chat with people like yourself who are on the fence, and I know in my heart that I can help them, but you've got a block, right? And it's not your fault. It's just you're a little bit jaded, right? You spend a lot of money, you spend a lot of time, you spend a lot of energy, and you're just cooked, man. And so we chat with you in early June of 2023, right? And it wasn't until, right, it's now mid-August, and you've been in the program about 4 weeks. Like, it took you a month, right, to actually be like 3 phone calls, I think, right, with this. Like, I remember texting you and going back and forth in different ways, right, to try to just like help answer your questions, man, and help you get over the edge. So like, what was going through your mind? Like, what was keeping you from being like, okay, let's do this, man? Like, what was stopping you?
I'll be super candid with you. A couple things. One is I've seen so many providers. It's all been face to face. And so that was a holdup. Is not. I'm like, how is a physical therapist going to work with me that lives hours and hours away from me? Like, that concept was foreign to me and it seemed impossible, to be honest with you.
It's good.
And like, if I think things through, and when I'm like, okay, I'm going to give, like I said, I'm going to be candid with you. I'm like,
it's good, dude.
I'm going to give money to a stranger over the internet. This is like what we tell our grandparents not to do. But I had watched a lot of your videos on YouTube and like really dug into what you're about. And I'll also be honest, when I signed up for the program, I did not know entirely what it was by any means. All I knew is you were saying something different than 10 other providers were. And when seeing that last provider, the one that I told you that had worked with the Patriots, I'm like, okay, something's got to give, because I've seen so many good doctors. None of them can come up with a cohesive, this is what you have, this is how you move forward. You were saying something totally different, and it intrigued me. And I'm like, what do I have to lose?
Got it. Okay, cool. So let's talk about this virtual skepticism, if you will, right? So look, man, I used to work with people in person. I used to teach manual therapy, like hands-on treatment and how to do it, right? To people when I used to teach at USC. And I no longer do that because, well, I never shook your hand, man. I've never even touched you, right? I just taught you. In fact, we've only met like a few times. And so at the end of the day, I used to be good at fixing people in the moment, but I found that people like you were terrible at fixing yourself. And the difference is this, man. I said, hey, Caleb, like, if you had my brain, do you think you'd be more or less confident in solving your problem? Most people would say more, but I need you to feel me. I need you to touch me, right? And so even though that had proven not to work for you, and you spent a ton of time and energy and money, right? You still had that belief of like, gosh, how is that going to work? Like, what would you say to anybody now, man? Like, knowing what you know now, right? And seeing the transformation you're seeing now, like, if you could have talked to Caleb, I don't know, 6 weeks ago, right? Like, what would you reassure him of and or let him in on? Or anybody who's watching this and is wondering, like, can you actually do that? Like, that's not the way I'm used to it happening.
You're the first provider that I've ever seen that's given me the tools to actually address the problem myself. I think what sets your program apart from anything that I've tried is it's so systematically set up to all right, so I'm a really type A, like, all right, let's get this done. Like, let's
Yep.
figure this out, and almost driven to, well, it was to my detriment in trying to figure out this problem. Like, okay, that didn't work, next. And had so many plates spinning, but none of them were pointed in the right direction.
Yep.
And you're the first provider that has just, it's so systematic in terms of, okay, you have this going on, try this tweak, and really looking at, okay, I know driving's an issue, but why is it an issue? And to actually get into the nitty gritty of pulling out the strings of what that actually looks like has given me the tools to start to piece things together again. I hope that makes sense. It's a complex problem, but it's not just rooted in my like physical environment, like how I'm sitting or what my posture is or what exercises I am or am not doing. Those things are all important, but how my mind, that feedback loop of this equals pain, which equals fear, is so real. It's so real, and it was the driver of, I think, the number one driver of what I have going on.
Yeah. Really cool, dude. So I hear a couple things, right? And this is the way I try to look at things. Most people, they reach out to me and they're like, hey, man, what's your chance of success or solving this?
Mm-hmm.
And little do they know that it's really just, it works. There is no, if you ask me, there is no better way to solve it than using the scientific method and or process for solving it, right? And so what I've made it about is not about me and my method, because I've tried to synthesize everything there is to leave no stone unturned to give people like you the best chance of solving it. Are you, as somebody who's in pain, willing to go through the process and to be a scientist in the process, to see the data and the feedback as or for what it is, which is just data and feedback, versus failure and then give up? So the only way, if you ask me, not to succeed inside of the process, right, is to just give up or be so closed off, right, that you have one failure, you fall off the bike, and then you're like, man, see, it won't work for me. But if you go through the process, as you did, because you shot me a message, I forget, maybe a couple weeks in, you're like, hey, dude, went through 16 rounds of looking for emotion to change my symptoms and didn't work. Ugh. But I'm proud of you because you were able to look at that, step back and look at that scientifically and see that as a piece of evidence or a clue that helped you iterate and get closer to the truth, right? And so I hear you saying it's a systematic process. And if you're willing to follow the process, then the chance that you like get no value or that you don't get a result or that you don't discover something you had not discovered before is probably not very high. Is that fair to say?
Totally. One thing that really stood out to me, and you gave an example with a different sport, and I just translated it to what I do, but going through all these motions, maybe one out of a dozen was bothersome. It doesn't make sense. You said it doesn't make sense for someone not to have pain when they lift their arm above their head, but to be able to go swim a mile. It doesn't make sense. And I related that back to me. I was having trouble with kicking my leg back and like doing that for repetitions to engage my glute, and that would cause pain. But like, wait a second, how would that cause me damage? But running for hours in the mountains, climbing, not like, it doesn't add up, right? That really has stuck with me. Yeah.
So the program, man, is designed, kind of like you were alluding to help you have aha moments or epiphanies about your current pain experience. Notice how I said to help you, because it's not my pain experience. I think this is what a lot of medicine gets a little bit backwards, is that like you're going to someone, it's your pain experience, and you're hoping that somehow they can plug into this thing and figure it out. Mm-hmm. But without them translating what they know to you and giving you the tools, you're the one with the pain, you're just disempowered and you're relying upon them. Now, if you had the tools and you had a process, which is what we give you inside the program, you're the one in pain, you feel it and understand it better than anyone else. Heck, you created it, not intentionally, but you did, all right? And now you know everything there is to know about pain on both the body and the mind side of things. How can you fail? I don't know, right? That's the idea. So cool, man. So virtually, obviously, it works, right? Mm-hmm. But I know that was not something that you were so sure of to begin with. But obviously, the educational piece allows you to have the tools, knowledge, and understanding to solve the problem. Now let's talk about, you mentioned the whole Charlie's a stranger thing, right? I didn't really know him, but you leaned into my content and you thought, hey, there's something different here that's being said. We do obviously the best we can, man, help you understand the concepts within the program, beforehand. But you're right. Like, even after we did that, did you get something different inside the program? Like, was it what you were expecting, or was it still like, hey, like I kind of got what I was getting into, but then when you came in, was it like definitely unique?
Oh my gosh, yes. It's like totally, like I said, it's totally different than what I had anticipated, especially in regards to the power of my brain in this whole equation. I was only addressing this as a physical problem and totally leaving my brain out of the equation whatsoever. And you've given me the tools to I guess to process, okay, what am I experiencing and why, and how to get out of that feedback loop, and not to have so much fear embedded in the whole equation of a situation. Just that reiteration that I am safe, I may be in pain. That's a real experience. It's not saying that this is all in my head, that this whole pain experience is in my head. It's saying that I have really strong associations with, at least with my personal story, that I have really strong associations with activities. Driving, running equals pain. And you've given me the tools to reprocess that those things don't have to equal pain. I maybe have some discomfort within those activities, but I have a whole host of tools that I can use to get myself out of that.
Cool.
Yeah.
Yep. And would you say, so let me ask you this. So, I get people reach out to me, right? They watch my content and they're like, so like, do you show me like the exercises in the program? Like, how's this all going to work? It's like, oh man, how do I bring someone from there to helping them understand that it is so much more than just exercise or just the way you sit? Because this is the way we've been led to, you see, if you go on YouTube, the top 3 exercises for stenosis, right? And then people are like, I already tried that, dude. What are you going to do different? It sounds like what you're saying. If you could sum it up, like, what is the main difference between like this approach and say something else? You kind of just alluded to it, but like, could you reiterate that?
Yeah. It's bringing your mind and your body together, because you can't treat pain without both of them. You just can't.
Dude, amazing. I don't know how I can say it any more succinctly. That was really good. Okay. And you were just focused on the body side of things. And so were all these other good doctors, correct?
Yeah.
Yep. And so you mentioned a minute ago, right, or a moment ago, like a big piece was not only the body, we tie in the best of the mind, right, and everything we know about that, and we combine it. We don't just look at them as separate entities. We don't just talk about psychology only. We don't just talk about like movement only. We try to tie those together and help you understand like how they're connected, right? But a lot of people might see this and they say, okay, he's talking about the mind again. Like, is this woo-woo stuff? I mean, are we just like throwing out some weird stuff here? Or is this like, I don't know, is it pretty legit? Does it work? Like, can you share that?
Yeah, and I think that's fair. And I think it's fair for people to have that assumption. I certainly did. Again, being blunt with you, is I'm like, okay, this seems like some hippie stuff that and I'm all for it, but I'm like, okay, I want to get out of pain though. Like, I was very skeptical, but in terms of the mind side of this problem, like I said, it's arguably, at least in my story, was more important in terms of helping me reprocess what was going on in my body.
Yep. Cool, dude. Good stuff. And so like, are we saying that it's all in your head and that the pain you feel is not real?
Absolutely not. No. And that's how I kind of perceived it at first.
Yep.
I'm like, this is not made up. Like, I am really struggling. And it only took me spending a day working through your program to say, that's not what you're trying to get at all.
Cool. Yep. Yeah, man. Lots of people, there's really an art to this. I've had people hang up. I've had people curse me out. I've had people, hug me, it's just, it goes one way or the other. Right. But that is definitely a barrier, because again, most of mainstream medicine, they live on the body side of things. If you've got stick figures, I love stick figures, man. If you've got body, you've got mind. Body is instrument of mind. If you only know the body, well, then you don't understand this. If you go to someone who only understands this, they don't understand this. And so we're trying to help link it, right? And that's what we do inside the program, which is so powerful. Let me ask you this, man. What would you say to someone who is like wondering if this is just going to be another treatment that fails and that they're going to waste their money on?
That you've already wasted your money. If you've seen this many providers and you keep getting spun around the revolving door of, unfortunately, the way our healthcare system is set up, what do you have to lose? And that's how I looked at it, in terms of finally being able to, my wife and I say, okay, let's give this a shot. It's something totally different. And again, what do you have to lose if this problem has been going on and it's affecting not just your hobbies, but your quality of life? I mean, for me, not being able to sit was just, yeah, I was miserable, man. I was miserable. I was struggling immensely, and finally just biting that bullet to say, why not try a different approach? Because I'm trying this. Essentially, I'm going to several different doctors. Although they're all giving me a different diagnosis, they're all telling me something is very structurally wrong with me and I should avoid all activity. And so you were a different voice, someone that didn't say those things. In fact, you encouraged me to run 2 weeks into the program.
Yep. Yeah. Neat. Do you think there's any way that someone could go through this and say, you know what, that was a waste?
No, not if you put the effort into it. And like I said in the very beginning of this conversation, I feel 50%, if not more, better with all my symptoms in a month. I feel like it is impossible to not at least get something out of this program.
Yeah.
I told my wife, I was like, oh my gosh, this is like taking a college course. Because that was a fear too, I'm like, gosh, I'm going to pay all this money for this program, and it's just going to be all the videos I could find on YouTube, and I totally am going to get scammed. And I got there, and I'm like, okay, there's a link, but it was like Inception. There's like 20 links inside the link. There's just so many materials and so much to learn and process that the program is just a wealth of knowledge, along with a community to support you.
Yep. Awesome, man. Cool. Anything else you want to say, man? I don't want to take up too much more time, but this has been awesome because you started in a really dark place, man. Not being able to sit more than 5 minutes, not being able to run, not being able to live life, dude. You're not that old. I think you're like roughly my age, right? And so really heartbreaking to see people like you pass up an opportunity where they can learn so much about how to resolve their own pain problem because they're stuck in that old medical paradigm of like, well, I'll just go get another MRI and see what they say. There's got to be something else. Heck, I even know you kept your MRI appointment, right? Because you were like, I just waited so long for this. I call that sunken cost fallacy. Nothing against you, but that's what happens, right? It's like, because I set this up, because I paid for this, or my health insurance will, like, I should just do it even though I'm not confident it will work. And then I know you were a little pissed because you went there and you're like, dude, in like 2 minutes, they told me like, I can't do anything for you.
Yeah.
Right. And so anything else you want to share, man, or anything else just to wrap it up?
What are you waiting for? Honestly, that's how I feel about it. If there is someone out there that's offering a different approach, try it. Yeah. Try it, because I mean, your life depends on it. It really does.
Yeah. Neat, dude. Cool, man. That's all I got. This was Caleb again from Virginia. Really cool transformation, dude. I'm just super proud of you, man, too, for being open-minded. There's always that initial resistance, right? Where I wonder like, hey, is this person, are they gonna get out of their own way, right? And allow themselves to do what they need to do? Or are they going to get stuck? And obviously that's why we have the coaching and the community and everything to help people get unstuck. But, we batted around a little bit, but you're definitely, man, really on the right path. And I'm just proud of you for putting in the work and being open-minded enough to do so. And so look, if you're watching this and you're like Caleb, where you've tried lots of different things, or heck, like Caleb probably would have saved a lot of time, energy, and money, man. I know we can have this conversation now, had like this been maybe the first or the second thing, right, that he would have done. And so if you're just like, hey, I just want to get like right to the source. I want to understand not only the body side of things, but then also the mind side of things. I want to find someone who can connect the dots for me. Then feel free, as an intro to kind of what we do, check out the free workshop. I'll link it above, kind of let you in on sort of how we work and sort of kind of gets you thinking a little bit differently and outside the box. And otherwise, you can always click the link inside the description to apply with us. I review all cases personally. So what happened is Caleb submitted his case. I reviewed it. I called Caleb, right? And/or messaged him and said, hey, man, reviewed your case, right? We will jump on a call with you or multiple calls with you if you're like Caleb and go back and forth, right? And we only do that if we feel we can help. If I don't feel I can help, we're just going to let you know that. So know that we're fair about that. So hopefully this was helpful. Caleb, I know you're going to inspire lots of people, dude. Let me know, man, how I can help you moving forward, and obviously lean into the program and the platform. We're going to get you to 100%. Cool.
Appreciate you.
All right, buddy. Take care, man. Chat soon. Okay.
Yeah, you too.
See you later.
Bye-bye.